And next, now we will be with Dr. Miriam Mikhail. She is a diagnostic radiologist. She's the head of radiology department at the International Atomic Energy Agency in Vienna. And what about Dr. Miriam? She's passionate about enabling medical imaging for all. And her lecture today will be about the IAEA and quality practices in radiology, audits, and more.
Thank you for this kind introduction, Hanan. Without further ado, in the preamble of the 1946 World Health Organization Constitution, the definition of health includes the enjoyment of the highest attainable standard of health as a fundamental human right of every human being. This highest attainable standard of health simply is not possible without measuring and achieving quality metrics for multimodality medical imaging too. I say too because to date, imaging metrics have not figured in the monitoring frameworks for global public health largely. Prevention and medicines reign supreme. For example, in the essential diagnostics list, only in vitro diagnostics are included to date. But Sustainable Development Goal number 3 of the UN, ensuring healthy lives and promoting well-being for all, simply cannot be achieved without the work you do. Quality indicators. As an imaging community, we need to spotlight key performance indicators and imaging metrics through our ministries of health and through our facilities as linked to epidemiologic priorities, ranging from trauma to tuberculosis, cardiovascular diseases to COVID. What we do is cross-cutting across the whole primary care and specialized clinical continuum. As an example, this is from a World Health Assembly side event last year, core quality indicators for cancer management. Number 1, the proportion of patients with biopsy-proven cancer. But imaging isn't mentioned. These are image-guided biopsies. Proportion of patients with complete tumor nodes metastases, TNM staging, again, via imaging. Proportion of patients who complete the full recommended radiotherapy or chemotherapy, these are decisions which pivot upon the imaging. Average time in patient's diagnosis, multidisciplinary tumor boards, everything listed here involves imaging, yet imaging is not explicitly stated. The key performance indicators of the Global Breast Cancer Initiative implementation framework, published by the WHO this year, with inputs from the IAEA as UN leads of Pillars 2 on diagnostics and Pillar 3 on therapy, we actually are measuring in countries the time from the patient's presentation to diagnostic evaluation, tissue sampling, pathology, all narrowed within 60 days. If we could do that around the world, it would be a miracle. And if you look at Pillar 1, the key performance indicator is to diagnose more than 60% of invasive breast cancers at stage 1 or 2. Unfortunately, in most places, we're far from this, but what gets measured gets achieved. We need to implement this. IAEA history of quality audits. Briefly, who are we? A UN agency, the UN family agency, global focal point for multi-purpose radiation applications worldwide. Our motto is Atoms for Peace or Development, Agency cornerstones include safety and security, safeguards, radiation protection, quality, and safety. And in our Division of Human Health, we assist member states through the planning and use of multimodality radiation medicine, including imaging, towards both national development goals and sustainable development goals. Comprehensive support, including dosimetry and medical physics. I won't go into detail, but our history is longer in audits of radiotherapy centers. More recently, quantum for nuclear medicine, now audits performed in 46 countries. And then, more recently, the quadrille audits. This is a free publication available online for radiology. And even if this is not adopted countrywide or not conducted in a particular facility, as this is freely available online, elements of the quality management spectrum can be adopted by a particular department in the absence of an audit, or individual professionals can learn from this, improving their own practices at a grassroots, on the ground level. We evaluate data, documents, and resources to check performance of the facility against standards. Our next audit will be at a facility in Jordan the week after next. So concrete achievements of these audits: quality management culture promoted, multidisciplinary audit teams trained, trainings in quality management in nuclear medicine, radiology, and radiotherapy, high impact throughout the world, and the audited centers. We have many publications, for example, this one on quality for digital mammography. We are integrating, we are members of the drafting committees of national cancer control plans. We are integrating radiology and quality into these national cancer control plans. It was absent before. And our technical cooperation projects to date in nuclear medicine and radiology, including quality, have taken place in over 144 member states. As you know, we're building upon the basic international safety standards, and a part of these safety standards was for us to develop a methodology for comprehensive clinical audit. So in conclusion, the IAEA audits are a primary but not unique tool via which the agency improves quality of radiology, nuclear medicine, and radiotherapy practices. Please feel free to access these publications online and adopt elements in your own practices. As a medical community, we need to recognize that quality, attainment of the best possible health, cannot be achieved without imaging as an intermediate step in clinical care. And some examples of recent radiology innovative ways of implementing quality: simulation trainings, including some procurements of simulators and use of phantoms, for example, for practicing quality breast biopsies. Improving teleradiology capacity. Teleradiology is embedded in the eHealth country profiles of the WHO. That is the one metric I can tell you in what we do that has already been embedded in those eHealth profiles. And we are gauging the digital maturity of countries through such metrics. Teleradiology, PACS, HIS-RIS, electronic medical records, virtual tumor boards, workflow, and the potential of artificial intelligence. And our AI is already being used on an interagency UN level for tuberculosis and chest X-ray screening to triage patients where human resources are lacking, such as radiologists and radiographers. So for radiology, we are aligning radiology protection, quality, capital Q, and safety with efforts to increase access appropriately. And this is an area we're greatly expanding at the IAEA. Thank you.